The Naperville Eldercare channel is brought to you by the great folks at Right at Home of Chicago's northwest and southwest suburbs. Today's guests are Jean Lamas and Dan Medina with Care Navigators.
Welcome back to the Naperville Eldercare channel. Our guest today is Jean Lamas and Dan Medina from Care Navigators, and the purpose of our conversation today is to share information about geriatric care management. Welcome, Jean and Dan.
Hi.
Thank you.
Thanks for being our guest today.
Thanks for inviting us.
And so, elder care management, geriatric care management, there's a lot that goes into that, but is it just geriatric care management that you do, or are you advocates for just adults and everyone, or just seniors?
We're actually, our scope of practice, we help people that are younger than geriatrics also. Some of our clients are 50 and 60 years old, so they would be considered on the younger side.
Mm-hmm.
So we do care management and advocacy for our clients,
Okay.
which is a large scope of practice of all the different responsibilities and roles that we have helping them.
Yeah, I didn't want to box you into just elderly, so.
Yeah.
It definitely happens a lot, but no, that's definitely not what we do. Not strictly geriatric care management. It's care management as a broad spectrum.
And a lot of people need that care management. We see it frequently in our business with the home care, but especially when someone is leaving a facility, they need someone to advocate for them, or even in a facility. So can you tell us when would be a good time for a family to call you?
Sure. Whenever somebody is, it's always great if people will hire us before there's a crisis. When somebody is reaching an age where they have a progressive disease like MS or Parkinsons or dementia, and they're early in their diagnosis, it's better to plan ahead, because we look at them from a large scope, financially, legally, psychosocially, medically, cognitively, and we look at their home safety. And we look at, do they need housing options? So it's better in a non-crisis situation to start with us, and then we can assist if they are in a facility. But if they hire us at that point where they're at a rehab facility or a hospital, we would advocate for them to make sure they're getting the right care. Are they in the right level of care, whether that's inpatient or observation level? Are they getting all of the right physicians on board to assist them, all the correct specialties? Are the medications correct? Is there any medications that maybe interact, or maybe they've had an issue with in the past?
I know that was something for us when a family had both of us on their team, and it was the client was being discharged from the hospital, and you were there actually from a facility, and everything was good to go, and you checked the medication, and they didn't have half the medication, and then the doctor wasn't in the building, and we were waiting for the staff to come and correct the situation, and I don't know, either they were busy or forgot or something, but because of your expertise, you were actually able to go and talk to the staff, call the doctor, and get the situation resolved much faster than if we had waited for the staff. And additionally, the staff hadn't caught that. And if we had gone home without that medication, the client would have had experienced a lot of suffering because they had something to do with pain medications. So, it was really beneficial for the family to have you there.
Right. And one of the big key goals that we're trying to always do is prevent readmissions, which we've had only 2 since 2012. So if we're able to, make headway and find the right solutions ahead of time, and sometimes as a care manager advocate, you're finding different avenues and opportunities to do that for the client within this healthcare system, we can help prevent readmissions too for the hospitals and the rehab facilities.
We find a lot of times, the adult children don't know where to turn, when they're feeling kind of lost because they're not here to care for the parent. And so can you tell us how do you help support adult children in this situation?
Yeah, sure. We help them in pretty much any way we can. First, the call we usually get is, just to set up a situation, is usually in the hospital. They usually call us when there's an emergency already occurring. We'll come in, go over everything initially, and just give them avenues and options. We really make the path clear for them where it used to be really foggy and muddy. And we just give them a lot of options of what is actually possible, what's reasonable, what's responsible for their family member. We support them by giving them knowledge and expertise by proxy through us.
And that's what we find too, is a lot of times the families just don't know where to turn.
Mm-hmm.
You know, and there is no class, you know, for this type of care unless you're, you know, listening to our radio show. But and
Yeah.
thanks for being a guest on the show. But that's the whole purpose, is to get the education out there, because it's not common knowledge to people. And the fact is that more and more people are going to need this type of care as the population ages. And even, you know, it doesn't have to be the elderly, but that's always my focus. But I know that we've had some situations with adults who have no family here, you know, and are from another country. We had someone recently that was here on assignment from South Africa, and ending up in the hospital, and having one of her work associates become her advocate because she didn't know who to have.
Right.
Yeah.
You know, and so how do people find out about you?
Well, they can look for us on the web. We're at www.care-navigators.com. We're with the Aging Life Care Association. We're with the National Care Planning Council. We're listed on those websites as people that are expertise that can assist them in navigating the system. They can give us a call.
And what's the number that they would call you at, Jean?
847-209-0823.
And then you were saying that you're experts. Like, I know you have a lot of initials behind your name. So could you tell us, you know, what is your expertise?
Sure. I'm a master's prepared nurse, and so it's a 6-year degree. And then I'm double case management certified. So I'm certified inpatient, more considered inpatient, and in the community. And basically worked in many capacities in nursing, from hospital to working at rehab centers as a home care liaison, working as a liaison, setting up readmission projects and programs. Private duty I actually worked for while I was in nursing school, so like right at home. Insurance case management, inpatient care management, utilization case management. So we've got a lot of experience, and then we also have social workers with community resource and social work background, and then we have healthcare advocates like Dan, and we have a lady that's in the city that are passionate about helping people navigating this whole system. And Dan's background, you can
Dan,
share
share
your
with us
background.
what your background is.
I have a bachelor's degree in psychology from Chicago, and I'm actually going back to school for occupational therapy.
Wow.
Yeah, I just had a pretty good interview with the school, so that's in the works right now, and I'm really excited for that. I want to be clinical.
Yeah, you'll be able to use that a lot more in your position here.
Yeah, I already do right now.
Yeah. And so, did you have an interest in that, or it's just you just didn't know like what part of the health care network you wanted to be in?
Oh no, I mean I was actually on track to be in occupational therapy school. I've been planning on it for a long time, and then I actually met Jean and started doing this, and it fits so perfectly because occupational therapy isn't just like squeezing Play-Doh all day, or moving your hands around. It's getting people out of hot water from like a new injury or a pre-existing physical drawback, disability, however you want to call it, to living their life as normally as possible.
We see it every day in home care. You know,
Right.
where we've had people that have traumatic brain injuries that are able to walk and talk and tell about it again, you know, as a result of the therapies that they've received.
Right.
Absolutely.
And when you know, any scope of practice, whether it's occupational, physical therapy, nursing, you always get your background in all of the anatomy, the physiology, the chemistry, the biology, so you understand more about the holistic person and what they need.
And then, Jean, I can't remember, are you a wound care nurse too?
You know, I'm not wound care certified, but definitely we can also provide wound care, because often you have skilled home care that's coming into the home and a caregiver, maybe from right at home, and you need somebody to fill in as that available caregiver. And a family can be taught to do wound care, but if they cannot do that, we have nurses also that can provide, tube feeding or wound care also.
Okay.
Yep. And so I worked in wound care for a very long time when I was a home care nurse out in the field.
I thought I remembered that.
Yeah.
Yes. Yeah.
So we can make recommendations and definitely follow the plan of care for them.
So, do you have any good examples of how you've made a difference in someone's life?
Oh, easily.
Yeah, we have a lot of different interesting stories and successful outcomes. So one of our clients, she's actually very young. She's 55, and Dan knows her very well too. She was incorrectly diagnosed with Parkinson's disease. She actually has MSA, and we were the ones that helped her navigate the system to find the right specialist. And she had gone to a couple of top specialists, so it's a totally different treatment plan that we're working with her on now. We helped her apply for disability. She'll have Medicare soon, so right now we're working with her husband's company to try and increase the services under the plan that they have for insurance right now, because the doctor that is in network, and there's very few for MSA, was considered not in network with his plan. So we were negotiating with the insurance company to get it in network so that at least some of that will get paid, and then also with the new insurance. We set up medications for her. We make a lot of medication recommendations with a physician. So of course we don't recommend the medications, but we're working with the doctor for that. So we're writing up symptom logs for her to see what is working and what is not. We've made tons of adjustments in her meds. We also have her on something to increase her blood pressure, and those are all recommendations and things that we're doing. We have a caregiver in there, so a company like Right at Home, we would be working with that caregiver to make sure that things are going smoothly for her family, cooking, cleaning, bathing, transportation. So we interact with the caregiver all the time.
Sure.
Yeah.
Yeah.
And I mean, we've done a lot of different things for her, and provide a lot of emotional support for the family. And right now, we're about to write up a pulse form for her. And the pulse form is so that we can write down all her medical wishes, because she is starting to decline a bit. She's never been hospitalized since, you know, we've been working with her for the last couple of years.
Wow.
And she's very debilitated.
Yes.
So.
Yeah.
And I think that everyone wants to stay in their own home, and we know, you know, you've worked in a hospital, that a lot of times when you go into the hospital with one thing, you come out with something else.
Yep.
So we find that, you know, if the clients can stay home, they're just better off. But the other thing was, in regard to insurance, everyone has like a maze of insurance, and it's so frustrating to try and work with the insurance companies. That, can you tell how you would help families with regard to that? Like, what success stories have you that you could share about insurance?
I'll let Dan answer that. I've been mentoring him in the insurance world.
Yeah, it's tough. It's really tough. I don't envy practitioners that have to deal with insurance companies. I had to do it for that specific client to get one particular treatment covered. It ended up covering around $8,000 worth of, you know, doctor time and drug material. It took a lot. It took a lot of time, a lot of going back and forth between different people, talking to the right people to get them to listen to you at all.
Right.
Is the hardest thing you can do. And I don't envy anyone that has to call an insurance company.
And I don't think that people understand now in general that in addition to having an advocate for healthcare, you really need an advocate for insurance.
Yeah.
If, you know, whatever condition or treatment you're seeking isn't being covered, that you need someone to be able to talk to the insurance company to help convince them to cover whatever it is, you know, that they're denying.
Yeah, we've challenged a few claims that have saved people $5,000 and $10,000.
Oh, yeah.
And we also help open up long-term care policy claims, and there's ways to maximize your savings there. So we explore the policy for them and help open the claim and try to get them to utilize the resources correctly. And some people wait too long to open those claims.
Yes.
And if you have a lifetime max on the policy, it's smarter to, you know, do that early, because you have a lifetime to use the policy. So some of our older adults are a little nervous about going down that. And obviously, with insurance companies, they have so many guidelines and regulations and so much written language in there that makes it very confusing, especially for a layperson.
And it's all written in like such
even
small
for the clinical
print.
person at times.
Yes.
Yeah, it's all in small print.
Yeah.
But we know how to navigate and cut through that, and I've done insurance case management, so
Yeah,
we're
so
able to help with that.
it's
Yeah.
good that you have that experience.
And
I guess.
Dan's able to help with that now also too. He's gotten a whole education on
I
that.
had a lot of experience in a very short time, and I'm okay with it. I'm okay stopping right there. It's hard. It's tough, but it's got to be done.
Yeah.
Yeah, and that's, you know, navigating the system. I guess that's why it's Care Navigators.
It's really accurate.
Yeah.
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 Yep.
Yeah, and so Jean, do you have any other stories that you can share with us on
Sure.
how the Care Navigators have helped someone navigate through the system?
I have a story of a client that you referred to us that you're working with at home. And this is one of the stories that I tell often is daughter called from Seattle. He was struggling at home and was threatening to injure the caregiver, more than injure the caregiver, let's put it that way, and had asked when he left the rehab center, well, he has dementia and he has agitation, and he had a history of being very violent with the family. I asked what medication was he put on for his agitation. Well, he hadn't been put on any medication. So we had nothing to work with at home to assist him. And it was at a very high crisis level, to the point where the caregiver was locked in a bathroom. So talked to the daughter, explained what we might need to do next, got agreement from her. Long story short, we ended up, I went out there and we had police involvement and the paramedics, and paramedics felt like everything was fine, and I said no.
And I think that's why that individual was released from rehab without
Yeah.
any medication, because they hadn't had that experience in the facility, and so they released him without that medication to keep him calm at home.
Yeah, because he probably did very well at the facility with a lot of people working with him. So yeah, we did get him into inpatient psych, and the paramedics were reluctant to do so, but the caregiver was able to sign the petition, and put the information down that he was threatened by him, and it wasn't a safe situation. Ended up, we went to the hospital. We had to move him to another hospital. It's a pretty long story. We worked with the care managers to do that, because things weren't really getting resolved where he was at. Then he went home, and we were there with the caregiver on site to make sure he had the right medications, got him home, started organizing and setting up his medicines for him. The care manager started going with on the doctor appointments, and we got a safe plan of care in place, and he did very well, actually. It was a very, very good outcome.
Yeah, for the family too, and that way
Yeah.
the daughter in Seattle would have peace of mind knowing that there was someone here that was watching for him, because I find a lot of times with the adult children, they have a lot of guilt.
Yes.
That they're away and that they should be doing more, or else there's some of the children that are here and some that are away, and one of the siblings doesn't feel that the others are doing enough.
Right.
And so by having a care navigator in, I think it helps the whole family.
It does. We do a lot of mediation with family.
Yeah.
Sometimes you can identify the role in the family, the youngest, the oldest, the middle, and all of the trauma from when people were young, especially if it's a very dysfunctional family, bubbles to the surface, and some of those personalities come out more than they did maybe 10 years ago, because they were living separate and had their own lives. Now you get them in a room together, or on the phone on a conference call, and all of that bubbles up. But we're good at mediating between that and identifying that it's the client that we're caring for.
Right.
But we also care very much for the family too, so we provide a lot of support back for them too. So you mediate through that and get to the right solutions, and that takes a little while, but it's a good outcome usually when you work well with people and slowly and partner with them.
Right.
Yeah.
And just the fact that you guys are the experts in the industry and know, the different people to contact, to help the family, and can recognize some of the behaviors that they're exhibiting and know where to refer them to, to help the family heal in all of those situations too.
Sometimes that's the hardest part, honestly. Just if you're in a crisis, having an idea of what direction and what people to talk to at all. That's truly the hardest part, because you're not really worried about your next step. You're worried about just getting through that horrible moment right there.
Just breathing,
and that's all you
really,
can think about.
Yeah.
It's totally all-encompassing, and I don't know how people deal with hospitals at all, honestly. Yeah, it's really hard from the inside.
Sure.
Yeah.
Yeah, we know that from the outside, just when people come home and the experiences we hear that they've had in the hospital without an advocate.
The hospitals that they're caring for a lot of people at once, and they're challenged by reimbursement and by what's going on in the industry. So the way that they would like to care for them, because they're all caring, compassionate individuals, they can't do what they'd like to do for each individual patient in the
I think that's why there's a shortage, in the nursing industry, because they're not able, the nurses aren't able to care for the clients the patients the way that they had envisioned. Besides the fact that there are more and more patients now, and there's going to continue to be more and more patients. So it's really important now. If you don't have a chronic condition at this point. We talked to someone recently about life care, and a care navigator is part of the life care plan.
Right.
That even if somebody didn't need a care navigator right now, we know that it's going to happen at some point, and so to engage you now
Right.
would be the best time to do it. So how would the audience engage you? Could you tell us your contact information one more time?
Sure, it's www.care-navigators.com, and they can call us. We have an intake number. They can call me directly on my cell at 847-209-0823.
Great. Thank you. Thanks so much for being our guest today.
All right, thank you very much.